Hi, this is Ada Ajaid from Med Lectures Express presenting to you how to study effectively for exams for APP students. If you're currently enjoying our content thus far, please subscribe to our channel. Thank you. A little bit of a disclaimer. This video is basically a synopsis of an effective study plan. Studying medical content can be overwhelming at times, but this approach will help you achieve greater retention of content or subject area. Key things to do is to have a proper desk, preferably spacious and comfortable, and a well-lit room. Study area should be comfortable, but not too comfortable. You may even have a light background music, maybe a light jazz music. I usually study with music, but I study with like gospel music, like Hillsong. That's just my personal preference. Also, plan on taking 10 to 15 minutes break after 30 minutes of studying because I think scientifically and also from previous studies, 30 minutes is about the retention time for a normal student. So it's preferable that you take, 10 minutes or even a 5 minutes break after studying for 30 minutes. And, you perform active recall of information prior to proceeding to the next topic. So basically, you're taking a break and you're doing an active recall. You're just asking yourself if the content you're studying is cell division. What is cell division? And active recall is your ability to recall the information you're studying without any material help. Another crucial step to studying effectively is to create a study schedule that is suitable to your needs. I personally don't go by any study schedule. I'm a bit eccentric, but I think that having a structure, having the topic that you want to study is a better way to study than just kind of freestyling it. The following are study strategies that should help you excel. Your study should focus on a system by system basis. For example, if you're reviewing GI disorders or gastrointestinal disorders or disorders that are circumscribed to the gastrointestinal system, you must know the following for success. Basic anatomy principles for the disorder or system, such as physical diagnosis specifics, which are namely physiological and pathological signs. Also, it's important that you know the epidemiology of the disease, the risk factors, and the etiological component of the disease process. So if you kind of structure your study around, just the basic anatomical principles, epidemiology and risk factors, or the etiology of the disease process, that kind of helps you focus the main points of whatever you gather from your study around these key concepts. Study strategies continued. Another key study strategy is knowing your patient demographic. So, for example, for patients with GERD, you want to know the type of patients that will typically present with a GERD symptom. Clinical features and hallmark signs. You want to focus your reading on features of high sensitivity, specificity, and subtle signs. Pertinent assessment features or findings. You want to know the physical exams or signs and findings that yield high sensitivity to diagnosis or that are specific, like strongly specific to the disease presentation. Okay. Important tools or diagnostic tools are key concepts of an effective study for disease conditions. Pay particular attention to physical exam findings that yield high sensitivity to diagnosis. Also, it's also important that you're able to discern and differentiate between tools or imaging or diagnostics that help with initial diagnosis and diagnostics that help with definitive or confirming diagnosis for the disease condition. Non-pharmacological interventions are also an important key concept of studying of disease process. You want to pay particular attention to lifestyle modifications, non-medication interventions as first-line therapy for certain disorders just like hypertension, GERD. You want to be able to pinpoint and identify what those lifestyle modifications are, and you want to be able to recall those information when you take your break from studying. Pharmacological interventions are another important concept in study strategy. You want to pay particular attention to the guidelines, heavy emphasis on guidelines because exam blueprints are based on guidelines. You want to pay attention to first line therapy, second line therapy, and third line therapy. You want to also be able to identify adverse effects of therapy. You want to know the relative contraindications, just meaning caution with therapy that possibly potentiates similar effects, but it is highly beneficial and recommended by task force. And also you want to know about the absolute contraindications of drug regimen, meaning continuing medication will cause a life-threatening event or in nursing a sentinel event. You also want to know complications from drug regimen on disease process or what can cause adverse reaction. Knowing the management principle of a disease condition is another key study strategy. You want to make sure that you know initial management therapy. You want to make sure you know the dosing techniques, such as using lower dosing strategies to limit dose specific effects in elderly patients or pediatric patients. You want to know the lab monitoring parameters, the drug serum parameters, as well as effective benchmarks that highlight benefits of therapy. So while you're studying, you want to make sure that you make a note of these key concepts, and you kind of put keywords of what each specific, like for example, the initial management, you put that under the management principles. You put the labs that need to be monitored, whether the drug drug levels need to be monitored, and effective benchmark that highlight benefits of therapy. Know when to use secondary agents. Know when to refer or escalate care up to the specialist. Know when the patient needs specialized intervention, for instance, patients with AFib or acute coronary syndrome. Know when to discontinue therapy secondary to adverse effects or efficacy. So it's important when you're studying and you have these components at the forefront, it helps to streamline your studying and helps you have a focus. So even if you see the questions on the exam, most of your exam questions are gonna focus on these specifics. And also you want to make sure that you consistently taking a break and recalling information. And you can kind of build up your study limit. If you feel like you can go for an hour without a break, you can do that by all means. But you want to take it day by day and build your tolerance up. Another key strategy of an effective study routine is being able to review the questions at the end of the chapter, or being able to review the board exam questions. So prior to reviewing questions, the important steps to follow include the following. While studying, pose questions to yourself about the disorder that you're reviewing. So that's where the active recall comes in. You're recalling information. You're trying to remember, well, what is GERD? What is the prevalence of GERD? What are the risk factors for GERD? So you're recalling that information to yourself without looking at your study material. You do this so that by the time you're done reviewing the disorder or the condition, you will have a good grasp of the study content. Another effective way to retain information is to create mind maps. It just means that you're creating a flow chart or shape schematics of the disorders you reviewed via active recall. And what do I mean by active recall? Active recall just means you're recalling the information you read without looking into your book. It is not memorizing. It's more than memorizing. It shows that you actually read the topic or the subject area and you understood it. If unable to recall info, then you refer back to your textbook or whatever resources you're using to fill in the void, and then you ensure that if you have to do it a couple of times just to be able to master the area, that's what you have to do. So you do it repetitively to fill in the void and master the area, and then you continue creating your mind maps. Before the end of the video, I'll show you an example of what your mind map should look like. This is just an example of a mind map for GERD, but it can be more extensive than what is listed below. For instance, a mind map for GERD should include the following: recalling from memory what GERD is, recalling from memory what are the main clinical features of GERD, the first line treatments, secondary agents, side effects profile, when to refer, complications of GERD, what are the physical findings in GERD, what are the main diagnostics of GERD. So a mind map can be limitless, but you also want to focus it on the main study concepts so that you don't kind of go on in a tangent, Last but not least, this is my very own personal study strategy. Like I mentioned, I am eccentric, so I'm not like a regular student. So when you're studying, make sure to study. When I study questions at the end of a textbook or at the end of a review book or board exam review book, I actually study the questions first. So what I do is, if I'm going to do 100 questions for the day, I study all those questions. So I go with question 1. For example, if question 1 is about what is the first line therapy for first line treatment for hypertension in African American. So if the answer choice says thiazide diuretic, ACE inhibitor, alpha blockers, mineral corticoids, for example. So what I usually do is, personally I know the answer, but if I don't know the answer, I study all the answer choices, like until I master it. So once I master that question, so in one question I've already studied like 4 drugs. So that's how I study. And then I move to the next question and I do the same. So basically, when you study the questions, you review the rationale before attempting to engaging and testing your knowledge. It helps to ground your knowledge. It helps with retaining information. It also helps you to study broadly. So by the time you're done with 100 questions, you possibly covered like a whole bunch of topics. So that's how I study. That's my personal study tip, and this is how I study a lot of the times. I do use the study the study strategies that I've previously mentioned. But along with that, I study my questions before I even attempt doing a mock exam. The following is an example of a mind map. So this is a mind map for GERD. So you have GERD at the beginning, and you're recalling information from memory on what GERD is. You're recalling what are the main clinical features of GERD, how is GERD diagnosed, what are the first line treatment, secondary agents, side effect profile, when to refer, complications of GERD. Repetition is key. Repeat above steps until knowledge is grounded, meaning until the knowledge is retained. This is just an example of how you should create your mind map, but it shouldn't be limited to this. It can be more than what is represented. So thank you so much for watching, and please subscribe to our channel. Thank you. Bye.